I'm Dr. Melanie Throne from Fort Worth, Texas. I'm a general dentist, and I always get questions online and from my patients about physical therapy or things that they can do while they are preparing for physical therapy, getting ready for tongue release or oral pharyngeal surgery for airway management, etc. Those people that are suffering as adults with all sorts of symptoms, occipital pain, headaches, jaw pain, face pain, even neck and shoulder pain, even down into the hips. While you're waiting for actual treatment for that, it is very difficult to manage those symptoms. So I have some tricks for you to try at home while you're getting ready for your treatment, just to try to help get you through your day and manage your pain, okay? We're gonna start with these little trigger point balls. These are actually made by this company. You can see up close there, that's the company. These are trigger point massage balls, actually for your feet, but I use them all over my body. You can even drop these in a sock, and they would go like this, tie a knot in the sock at the top right there, and that keeps them together. And they can go right at the back of your skull, right here and here, and roll around. You can find the exact spot that's putting pressure. And what you want to do is get on the bed. There's 3 different pressures you can utilize. If you lie down on your bed or on your couch or recliner at home, you lie back and apply pressure on a pillow. See if you can get that right on there to the trigger point where you're feeling your pain coming from. It'll be tender, but you want to just allow the pressure from your head, the 10 pounds that your head weighs, to put pressure on those trigger points using these balls. If you can't find these balls, you can use tennis balls dropped into the sock with a knot tied in it. They're just as effective, I find. But the pillow is the first level of pressure. You can remove the pillow and lie back again, same way, on the actual mattress. That will put a little bit more pressure. And then finally, if you really need more pressure than that and can tolerate it, you can lie down flat on the floor and put the maximum amount of pressure on there to target those trigger points. This becomes most effective when you warm the muscles first. And the way that we want to do that is, I have my patients, this is a rice-filled bag, therapeutic bag that I get at Bed Bath & Beyond. You can get the 20% off coupon that comes in the mail, it seems like every day. This will cost you less than $10 with that coupon. And it's long, has convenient little handles on it, hangs on the shelf just like this in this bag. They can come in different colors, so this one is a little bit old. It may be a different color, what have you. And Anna has one around her neck that's pink. We're going to demonstrate in just a moment. Anna was nice enough to make this one from scratch for me so that it matches our purple colors here at the office. This one has pinto beans and rice, dry rice in it, and is sewn into a piece of terry cloth, just towel material, and then we custom made just some nice material on the outside, a sleeve to put it in, so that this piece can be taken off and washed and kept clean in between patients. But whichever one you decide to use is up to you. What we want to do with that, I'm going to tilt you back in, is you want to heat it in the microwave for about 1 minute to 1 minute 20, and place it around your neck like I've got for Anna here. And what we're targeting are these large facial muscles, the smaller muscles back here that operate the jaw, and the temporalis muscle. This is a very large muscle here that's involved in the chewing and mastication process. And then we're also targeting at the same time the occipital and all the capitis muscles back here. What you want to do is put it there and then wrap it in front of your ears on both sides and bring it up the side of your head. And I would leave this for at least 5 minutes. If you can do this 4 times a day, that would be great. Shoot for at least that. Be lucky if we get 3 in. If you can leave it for at least 5 minutes before you try to do your trigger points with these balls or the tennis balls, that's a great help to you. There's also some areas that we can put pressure on, trigger points for the face, and inside the mouth and the head and such. So let me show you that real quick. Get my gloves, and what you do is, obviously on the outside of the face, this works much better with the muscles warmed up. The outside of the face, you'll actually feel and see sometimes that there's a knot here. That knot in the large biting muscle here, it's usually right around the first molar, and you can feel it and it'll pop if you touch with your fingers. And you want to take some deep breaths and just push in gently. It'll be tender, but you don't have to push hard. And take deep breaths in and out, bringing the oxygen to that area, just like a massage therapist would do a trigger point treatment in your shoulders or back. It's the same type of a principle. You can also go deep into the belly of the muscles and put pressure right into there, almost push back just a little bit towards the bone and towards the ears. Yours is tender on the right, I bet. Feels tight on the right. And continue to breathe, bring in the fresh blood supply and oxygen, help to release some of that. And then a third spot is up here. There are even some trigger points that you can do and you can find right through here, or I'm going to take your glasses up for just a second, right into the eye and push up like that. All right. Again, all of those, especially over here, you want to do while you're breathing. So the balls can attack back here on those trigger points in the back of the neck and the upper shoulders and even down the spine. But to do the face, you've actually got to do that by yourself with your fingers. Normally is how the easiest way to do that is. I'm going to show you one release on the inside of your mouth. You want to take your index finger or your thumb, and I'm gonna have you open really big, and you want to target back behind the teeth, right back by the ear where the jaw actually is opening like this, right on the inside, and the bone for the mandible comes across here and then heads up like this, and we want to go where it's heading up from the inside. And there's a little muscle band, but will feel huge, and you put your index or your thumb on the opposite side hand. So since I'm on her right side, she would use her left index finger or thumb, come inside the mouth, way back behind the teeth, and feel where the bone lifts up. And you will actually, I'm gonna have you close just a tiny bit right there, and you can feel the little muscle roll back and forth across the bone and your finger there, and you put the fat pad of the finger right on that and trap that little muscle right there and push against the bone. And it will be tender for some, but you push and then do your deep breathing for about 10 seconds, getting the oxygen to that area and the blood flow into that area to try to clear out some of the buildup there. All that lactic acid from overworking that muscle, from it firing differently. Now, the jaw is unique in that it is the only place in the body that has two joints functioning together. And so a lot of times you'll see pain on one side, but the actual problem and issue is on the other. So every time we do this exercise and we target that muscle, we need to do the same thing on the other side. And so, Anna, I'm going to do that for you. It's easier for me to use my thumb on this side. We're going to slide there again, find that where that bone raises up, and trap that muscle and push out towards the ear. And count to 10, and she's going to deep breathe. Deep breathe, deep breathe. Good. Good. And then we'll release and rest. And I would repeat that, especially after warming the muscle with the moist heat from the rice bag. Repeat that 3 or 4 times, stretching in between to open and close and begin to work that muscle and the soreness out of that muscle a little bit. If you have a pop or an actual event that creates inflammation in the joint, that is an instance where you might want to use ice several times a day rather than the heat. Right after that event occurs, do it for 2 to 3 days, then you can switch to the heat and begin to work that soreness out, work with the muscles, okay? I'm not a physical therapist. This is not meant to subvert the physical therapy aspect. This is only meant to try to get you through the symptoms and manage your day until you can get in to see the therapist and get some resolution actually to your issue, whatever that might be. If it's muscle and jaw related, or if it's symptomatic muscle and jaw and pain through the neck, muscles, things, shoulders, due to tethered oral tissues like tongue tie, lip tie, or your buccal cheek areas being caught and tied. Okay, I hope that helps you, and we will be putting this video on my website, which is mvcdds.com. Hopefully that will help you, and we look forward to seeing you later.